New research is showing GLP-1 medications are helping prevent cancer. They are FDA approved to treat type 2 diabetes and obesity. But the American Society of Clinical Oncology says these medications may be reducing the risk of colorectal cancer. The American Cancer Society reports GLP-1s may make it harder for cancer to grow in the body through three methods: starving out the cancer cells by reducing the levels of substances in the bloodstream, reducing inflammation, and improving cancer detection. Researchers say the drugs may be making immune cells better at finding and destroying cancer cells before they take root. Excess body weight is also a known risk factor for at least 13 types of cancer.
As we see improvements in weight, because these obesity medications and specifically the GLP-1s are so effective, we anticipate to see benefit with cancer rates as well, with those cancers that are associated with obesity.
Braddock says at this point, none of these medications are FDA approved for treating or preventing cancer. More studies are underway to better understand the external benefits of these medications outside of just weight loss.